you have actually two sets of joints, I guess you could say, between vertebrae. Um, the intervertebral discs, you're probably already familiar with these thingies here. That is what? We actually learned this in chapter 4. It was a great example of fibrocartilage. So fibrocartilage is a cartilaginous joint. Specifically, the classification is a symphysis. So it's a symphysis joint. Well, cartilaginous is the broad category. And the specific category within cartilaginous would be symphysis because this is fibrocartilage. That's what the discs are primarily made of. And we're going to take a closer look at those in a little bit. But I want to also point out the one I started with, the articular processes, which I showed you a bit of right before the exam. These little ovals here, and I've got some arrows pointing to them. Those ovals meet up on the superior with the inferior one here. There's the joint. And then you can see it here as well. You can see a couple joints right there. Those are tiny synovial joints. So they are fully synovial in that they have a joint capsule and a synovial membrane, and there's synovial fluid in there. So these joints, these synovial joints, are the reason that your vertebral column can make popping noises when you stretch it. You know, you crack your back, like cracking knuckles. Cartilaginous joints do not produce that kind of sound, neither do fibrous. The only joint that makes that popping sound is a synovial joint. So I'm going to pause briefly and back up and talk about why that is. Come on, back way up. Oh, too far. Okay. What happens when you crack a knuckle or pop a joint? So it only happens in synovial joints, and it's because somewhere in the joint cavity here, there's a little gas bubble. It's usually carbon dioxide. So remember, synovial fluid, it comes from blood plasma. It's filtered from blood plasma. So it has various gases dissolved in it. So carbon dioxide is carried by your blood primarily through just being dissolved into the liquid suspension, the plasma. So what can happen is that these carbon dioxide molecules will coalesce, they'll precipitate out and form a little bubble. So you have a carbon dioxide bubble there. Then when you pull the two bones away from each other, not towards each other, but you're not squeezing the joint capsule, you're actually pulling it apart, this bubble can pop and make a cracking sound. What happens is all the little individual molecules, carbon dioxide molecules, will dissolve back into the plasma. Now, it should take like 10-15 minutes before you can do it again, before another gas bubble forms, but I've known people who could do it multiple times. I assume they've got multiple gas bubbles in there. So yeah, again, only synovial joints because it happens in synovial fluid. Does it harm your joints? My mom used to say that it did, but she was wrong. It doesn't do anything to your joints. You're actually not rubbing the bones together. You're actually pulling them apart. And that carbon dioxide dissolving back in doesn't do any harm at all. It kind of sounds like it might, but it certainly doesn't. So feel free. Crack your knuckles or anywhere else as much as you like. Okay. Okay. That's all we're going to do with synovial. I just want you to note that the articular processes are little synovial joints. That's how you crack your back. Let's focus more on the discs and what's going on there. Okay. This is an image that's made by an MRI. And you won't have an image like this on the exam, but it is kind of cool to see because in a clinical setting, you're more likely to see a lot of this anatomy on some sort of imagery like this MRI, rather than surgery, though you may end up there. So these are actually two images. There's like a split down the middle here of the same individual, and they're taken at different slices. So what slice is this? You can see the bodies there, and there's some of the spines that come off of it. So hopefully you're thinking that this is a sagittal section, and one of them is more mid-sagittal than the other, these two images. So, okay, so if I draw a vertebrae here, like a superior view of a vertebrae, good enough. So this one here on the right, it's a slice pretty much down the midline Whereas this one over here is off to the side a little bit. How do I know that? Those are the spinous processes, those bumps on your back, this thing. So if they're in the image, it had to have been pretty close to mid-sagittal. This one, there's muscles and stuff there, but there's no spinous process. So it has to be the parasagittal one over here. And this is the mid. No, you will not have to interpret an image like this on the exam. I'd have a drawing maybe if I decided to do another section. But really, I'm just telling you this to orient. What on earth are you looking at? So this is a sagittal. So it would be a medial view, basically. And then you can see the vertebral bodies, of course. And then that would be the anterior on this side. So this would be anterior and posterior over here. Actually, oh, look, anterior, posterior, anterior, posterior. So, of course, the spinous processes are in the posterior, the vertebral bodies in the anterior. Okay, so what's going on? There is something wrong with this person. This person got an MRI because probably in pain. Hopefully you can all, there we go. That disc, especially right there, is herniated. That is the technical term. So a herniation is there's a lot of different hernias that can happen in the body, but any place in which some substance is bulging out where it shouldn't. So this person's in pain, I promise you. I've had it happen. And a lot of people I know, at some point in your life, it's not too infrequent. My brother had it and he works for UPS. So how do you get it? Is usually carrying something heavy in front of you, like the anterior. So you got a big box, imagine. And there's all this weight and pressure pushing down. And what happens is these discs get squeezed and they'll just push out and bulge out that direction. Usually in the lumbar region, hopefully you can tell this is lumbar, like this is the sacrum down here. This is L5, 4, 3. So it's the disc between would be the L3, L4 disc. I think mine was actually there. So what's painful about it is that this bulge is pressing on nerves in your in the vertebral canal there. And so the pain is not at the disc itself. The cartilage discs don't have very many sensory receptors. But the nerves, of course, are, pinch them off. There's lots of sensory information. And what usually hurts is your lower limb. So these nerves would eventually lead down to your leg. And you'll get shooting pain. I had shooting pain all down posterior thigh into my toes. Really, it was terrible. And in order to treat it, and there are extreme surgeries and things like that if it's really bad. In the case of a pretty minor herniation like I had, you just wait. And hopefully in the next month or so, it will heal itself. It never really fully did. I'm sure there's still a little bit bulging out there because sometimes I can feel it. But you're also supposed to rest during that time. It's really hard for someone to take a month off and lay in bed. But that's unfortunately the best thing that you can do. In many cases, surgery is pretty extreme if it's a really bad case. Okay, so what's going on when you have a herniated disc if we're looking at the actual disc in anatomy very closely? So the annulus fibrosus, that is the cartilage rings. You can kind of see, not exactly round, but you can see these layers. That is fibrocartilage rings. So annulus fibrosus is made of fibrocartilage. So again, annulus fibrosus is the name of the structure. And fibrocartilage, sorry, that should be an A, G. Fibrocartilage is the tissue type. You also have another portion of the vertebral disc that I didn't talk about. I just told you it was fibrocartilage, but in fact, in the middle, there is this stuff called the nucleus pulposa. It's basically like jelly. So you don't need to know anything more than that. It's just jelly. I'm not going to give you any kind of tissue type. And so what happens when you've got a herniated disc is the annulus fibrosus can literally just tear. You can see right there. So these fibers should have been connected, more like over here. And all of the force caused this tear, this rupture. And then the nucleus pulposa, that's like, gel, goo, it has a way to get out. It's like it's lost a boundary wall. So it presses into the vertebral canal, and you can see there's a bunch of nerves there. We'll learn this more in Unit 3. Don't have to worry about it now, but actually your spinal cord ends at about L1, L2 vertebrae. So at this lower lumbar level, these are all just spinal nerves coming from the spinal cord and heading down. But the point is, Herniated disc pinches nerves. It's painful. It stinks.